you sleep last night? The answer to that question could reveal a lot about your health. If you keep tossing and turning, Dr. Joseph Golish is here with help so you can get a good night's sleep. Dr. Golish is with the Center for Sleep Medicine at MetroHealth. Welcome to the show.
Hi, Lauren. How are you?
So tell us, why is sleep so important to our health?
We are literally bombarded with media coverage of diet and exercise, but in fact, the third and most important actually is sleep. Why is it most important? Because it affects us every single night. Plus, in addition to that, we're unconscious when bad things are happening in our sleep. We're unaware of it. And the restless sleeper, regardless of the cause, not just sleep apnea, but snoring, insomnia, and so on, cause microarousals in our brain, which trigger a fight or flight reaction by the body that is really harmful to our health. Our blood pressure and pulse shoot up multiple times through the night. We don't know it. In addition to that, we're also deprived of the restorative sleep, the sleep that kind of reboots our internal computer. So the result is our brain doesn't function nearly as well after bad sleep, and that means poor decisions, difficulty solving problems, poor memory, and even stress, anxiety, depression all can result from that. Okay,
now you mentioned sleep apnea, and a lot of people know what that is, but what are some of these other issues that can cause you to have a restless night?
Well, even primary snoring, people who don't have apnea but are disruptive snorers, can cause high blood pressure, heart trouble, and so on, not to mention difficulty sleeping. In addition, side snorers, sort of like side smoke, they are actually victims. They lose several hours of quality sleep each night.
Because they hear the partner sleeping, they're snoring.
Absolutely. And then in addition, insomnia, restless legs, shift work, the night owl syndrome, all of those can cause the same sort of disruption of the sleep that affects our health and our memory and our emotional mood function.
But you say a lot of these sleep disorders are not diagnosed and treated. Why would that be?
Well, the reason for that in part is because we often think of these problems as just a nuisance. It's something there really aren't any good treatments for, which clearly is a misconception because there has been a revolution in treatments as well. And so we end up self-treating. We go to over-the-counter medicines, nutrition shops. We go online, we go to infomercials and try different devices. But also because there's such constraints now on cost in the healthcare system, the healthcare system really doesn't want to make it easy to get patients with those disorders treated medically, which they actually should be. So it's incumbent on patients when they have those problems to seek the right provider and be their own advocate. And that's what I tell my kids and grandkids. The healthcare system's different than it once was. Marcus Welby's long gone, if you remember him.
Oh, yeah.
And so they really have to be patient and persistent in working through the system to get the treatments that they need.
And there are new medications and new devices that help you with sleep apnea, snoring, all this restless. So tell us about some of that.
Yeah, just like this last decade of understanding of the bad things that happen in our brain and body with bad sleep, there have been a revolution in new medications and new devices for treatment, but they often don't get employed because people don't know about them and their providers aren't necessarily helping them get to them, nor is their health insurer and so on making it easy.
There's a new medication though first.
Yeah, well, new medications. There are two very revolutionary medications. One that blocks the wake hormone, or the wake hormone is orexin. These are orexin blockers. There are other stimulants that are non-stimulants, not addicting, unlike the drugs that we did use in the past, and we still have to use often because they're the only ones covered, are amphetamines, which have their own problems of tolerance and addiction. There are also meds that are non-benzodiazepines, not addicting, non-harmful, that should replace most of the drugs over the years that we've used, like zolpidem. And then there are also devices, devices like CPAP, that's on the left in this panel, and a lot of people just can't or won't use their CPAP, and there's a nasal valve that is FDA approved that can replace all of that fancy technology, and about 90% of the patients who won't or can't use CPAP we can salvage with that device. And then there are also oral devices. One is a tongue retaining device, just pulls the tongue forward. The other is a mouth guard that pulls the lower jaw forward. And the result of that is opens the airway in another way. Again, alternatives, both for snorers and for apnea patients. And then finally, this is a device that's been available in Europe for some time. In fact, even health insurance pays for it in Europe. It just came to this country, but it's a pillow that senses when a patient snores or has an apnea, and then it changes the position of the pillow. It inflates compartments to change the location of the airway to eradicate the snore and the apnea.
Amazing.
That's revolutionary, without having to wear anything on the face or in the mouth.
Great tips. If a good night's sleep was a long time ago for you, Dr. Golish has shown that there are new options for alleviating many sleep issues. To learn more, use the information that's coming up next. My thanks to the doctor for waking us up to these slumber solutions.
To learn more, call MetroHealth at 216-778-7800 or log on to www.metrohealth.org. Next, it's